Introduction. Welcome to today's lecture on the pathophysiology, clinical presentation, diagnosis, management, and long-term outcomes of intestinal obstruction. This comprehensive study will delve into the intricate mechanisms behind blockage in the gastrointestinal, GI, tract and the various nuances associated with this medical condition. By the end of this lecture, you will have a thorough understanding of the topic, empowering you to diagnose, treat, and care for patients presenting with intestinal obstruction. Intestinal obstruction refers to the partial or complete blockage of the normal flow of intestinal contents through the GI tract. Understanding the underlying pathophysiology is essential to grasp the complex interplay of factors that contribute to this condition. Intrinsic and extrinsic causes, such as mechanical obstruction, adhesions, tumors, hernias, and strictures, will be discussed in detail, alongside the impact these factors have on the normal functionality of the GI tract. Recognizing the clinical signs and symptoms of intestinal obstruction is crucial for an accurate and timely diagnosis. This section will provide an in-depth understanding of the characteristic features that differentiate partial from complete obstruction. We will explore the presenting symptoms, including abdominal pain, distension, altered bowel habits, vomiting, and the potential complications that may arise if left untreated. Accurate diagnosis of intestinal obstruction heavily relies on diagnostic imaging modalities. This section will provide a comprehensive review of the various imaging techniques employed, such as plain radiograph, ultrasound, computed tomography, CT, magnetic resonance imaging, MRI, and contrast studies. The advantages, limitations, and specific indications for each modality will be thoroughly discussed to guide clinical decision-making. Intestinal obstruction can be classified into different subcategories based on the site, level, and underlying etiology. This section will elucidate the distinctions between simple and strangulated obstruction, as well as the variations in small bowel and large bowel obstruction. Furthermore, segmental and non-segmental obstruction will be explored, along with their implications for management strategies. Left untreated, intestinal obstruction can lead to various complications and sequelae that significantly impact patient outcomes. This section will delve into potential risks such as bowel ischemia, necrosis, perforation, sepsis, and peritonitis. The pathogenesis, clinical manifestations, and treatment strategies for these complications will be thoroughly examined. Managing intestinal obstruction requires a multidisciplinary approach encompassing medical, surgical, and supportive measures. In this section, we will discuss the initial resuscitation, fluid and electrolyte management, pain control, and nutritional support. Non-operative management, including conservative approaches, bowel rest, and the use of decompressive techniques, will be explored alongside the indications for surgical intervention. Surgical intervention remains the cornerstone of management for many cases of intestinal obstruction. This section will provide critical insights into different surgical techniques such as adhesiolysis, resection, anastomosis, strictureplasty, and stoma creation. The advantages, patient selection criteria, potential complications, and long-term outcomes associated with each procedure will be thoroughly discussed. Optimizing perioperative care is vital to minimize complications and maximize patient outcomes. Topics covered in this section include preoperative assessment and optimization, antibiotic prophylaxis, deep vein thrombosis, DVT, prophylaxis, intraoperative considerations, postoperative pain management, and early mobilization. Emphasis will be placed on individualized care, addressing comorbidities, and ensuring a smooth perioperative course. Maintaining adequate hydration and electrolyte balance is crucial in the management of intestinal obstruction. This section will provide a comprehensive understanding of fluid resuscitation, assessing volume status, electrolyte imbalances, and the use of crystalloids, colloids, and blood products. Strategies for monitoring and adjusting fluid therapy to optimize patient outcomes will also be discussed. Anesthesia plays a pivotal role in the management of patients undergoing surgical intervention for intestinal obstruction. This section will focus on the specific considerations for anesthesia administration, including the choice of anesthetic agents, airway management, the avoidance of abdominal compartment syndrome, and the importance of vigilant monitoring during surgery. Minimizing intraoperative risks while ensuring patient comfort and safety will be the primary focus. Despite meticulous perioperative care, postoperative complications can still occur in patients with intestinal obstruction. This section will explore potential risks such as anastomotic leak, wound infection, adhesive bowel obstruction, pneumonia, and deep surgical site infections. Early recognition, aggressive management, and preventative strategies will be emphasized to enhance postoperative recovery. Long-term follow-up is crucial in patients who have undergone treatment for intestinal obstruction. This section will discuss the comprehensive assessment of postoperative outcomes, including the evaluation of bowel function, quality of life, nutritional status, and potential long-term complications. Strategies to optimize long-term outcomes, including lifestyle modification, dietary counseling, and surveillance for potential complications, will be explored. Understanding intestinal obstruction is crucial for healthcare professionals. Knowledge of pathophysiology, clinical presentation, diagnosis, management, and outcomes leads to improved patient care, treatment decisions, and postoperative care, resulting in better patient outcomes and quality of life.